Hi, my name is Russell Pohl, and this is part 2 of BC Foster Basics episode on facilitating connection with families of children and youth in care. Guidelines for supported visitation. All planning for family visits must be developed by the child's social worker. Safety is the first consideration, and as such, foster parents may be asked to arrange for alternative means of contact such as a phone call, cards, and letters, or providing pictures or journal to the social worker to pass on to the family. Limiting contact rarely applies to all members of a child's family, so it is likely that someone will be able to have visits in person. Visits should be manageable for your family's routine activities. However, as visits are in the best interest of the child, caregivers must do their best to facilitate visits. A visitation plan created by the child social worker should include frequency of visits, location and length of visits, who is allowed to visit, supervision expectations, specific goals of the visit. The first few visits can be uncomfortable for the child and parent or other family members. It is a good idea to bring along some activities such as a puzzle, game, storybook, or Play-Doh, as well as a snack. Remember that you have a duty to report to the social worker about the visits, so pay close attention to the interactions and to any changes that you see. Foster parents should engage with the family members by setting clear roles and boundaries with the family, making sure that the parents know that you don't want to keep their children and that you are part of a care team to support the child. Sharing information about the child's daily activity, progress, and growth. Asking if you can take pictures of the family to put in the child's room. Sharing things that the child has done at school or in your home, such as arts or crafts. Inviting them to attend events, appointments together, such as school concerts, doctor appointments, birthday parties, and haircuts. Ensuring that there is a plan for ending the visit. Ending visits with a family can be very stressful and difficult for all parties. Ensure that you give the child and parent lots of notice that the visit is about to end and communicate your expectations about how and when you will leave. After a visit, children may be upset or show signs of regression through behavior such as crying, tantrums, lack of appetite, soiling themselves, or forgetting how to do things they've already learned. This is expected behavior of a child who has experienced loss and is grieving or confused. These behaviors are not reasons to stop visitation. Give children permission to acknowledge their feelings by talking about it in a supportive way and helping them express themselves. Even pre-verbal children will experience grief and loss. Be aware of this and provide lots of extra attention. If missing a visit is unavoidable for you and the child, or if a parent misses a visit, be honest about it and acknowledge their feelings. Concerns and worries about relationships. Relationships between foster and birth families can take many forms. They can be close and cooperative, tense and strained, or anything in between. Parents want their children to come home, so for the most part, they are cooperative. If you have any concerns during a visit, report them immediately to the child's social worker. Always refer the birth family members to the social worker to discuss any difficult issues and to answer any questions they have about planning of visits or court. You are not the case manager. All information must come from the child's social worker. If a birth family member criticizes the things that you are doing, remember that they want the best care for their child and they hope to be a better parent themselves. Do your best to listen and explain the reasons for your actions and choices around the care of their child. I hope you've enjoyed this segment of BC Foster Basics. If you need further information or assistance regarding facilitating connections with families of children and youth in care, or any other fostering subject, please call us at 1-800-663-9999 or check out our website at bcfosterparents.ca. Also, please don't forget to visit the BCFFPA YouTube channel regularly for more topics in the BC Foster Basics series. Topics such as healthcare for children and youth and many more.